Now, the other big issue we're focusing on is mucomycosis. In recent days, there has been an increase in the detection of a rare but deadly fungal infection known as mucomycosis, or colloquially as we refer to it as black fungus, in COVID patients. Now, it appears in the skin, also affects the lungs and the brain, and cases of the infection have been reported from Maharashtra, Delhi, Gujarat, Madhya Pradesh, more recently in Goa as well. In severe cases, the cost to many of the COVID patients has been that their vision, jawbones and nose have been affected by this infection. To talk more about this, we're joined by Dr. Ajay Swaroop, Chairman, ENT Department, Sir Gangaram Hospital, and Dr. Sumit Mirig, Principal Consultant and Head ENT, Max Hospital, Sake. Thank you so much, doctors, for joining us on the show today. Dr. Swaroop, first and foremost for viewers, I know many of them have heard about this black fungal infection that's emerging, mucomycosis in COVID patients, but just again, if you could explain to us, what is this exactly?
Well, it's a very serious fungal infection which is known for hundreds of years. It's not that this is a new thing which has come up. Only thing is that its incidence was very, very low, and it was seen in certain patients who were severely immunocompromised, had cancer or had HIV or certain conditions in which the immunity was very low. And we have been seeing cases of mucomycosis. It has always been a very, very serious and a deadly disease, and it has led to a lot of morbidity as well as mortality. Unfortunately, because of COVID, and especially in this wave, though of course we had reported in the first wave also, the incidence has shot up. I mean, it is totally unprecedented.
I remember reporting this during the first wave as well, but this time the cases, are so widespread from so many states. They're emerging. Dr. Mrig, what many people want to know is there any relation to COVID? Is this coming, is it connected to the disease, or if you could explain to us how it's more connected to the kind of treatment that people are receiving?
See, like Dr. Swaroop said, mucomycosis is nothing new. We have been seeing it. But in the second wave of COVID, what we have seen a very steady increase in the number of cases. And COVID by itself has made the immunity of the patient very weak. And in this way, because of the severity of disease, many patients have taken huge doses of steroids. Many of them have taken it at home, which have been unsupervised. Now, many of these patients were pre-diabetic, which they were not even aware. Now, the sugar levels in these patients who I'm seeing in the OPD has been very alarming rise to a range of about 300, 400. Now, mucomycosis is something which actually proliferates into the nose and the paranasal sinuses. And if you have a high blood sugar level in your body, it helps in spread of the disease very fast to the orbit and to the brain. Now, while we did not see as many cases, maybe because of two factors. One was maybe the virus strain which has hit and cause of the second wave is very virulent, number one. Number two, it suddenly involved such a huge number of population that most of them were not able to reach hospital, were not able to get beds, so they had no option but to start treatment at home. And I think there was a lot of panic for the use of steroids. People think that it was a life-saving procedure, and there was an unscrupulous use of a lot of steroids, which has led to this sudden proliferation in the fungal infections in this wave.
Right. Dr. Swaroop, now we've had certain reactions to this. I do know in Maharashtra, they've issued guidelines, how to recognize cases of mucomycosis, which is very important that you recognize it early on. You have the DC of Faridabad actually, tweeting out saying that no chemist will sell steroids of any kind without proper prescription to avoid black fungus disease. No sale of steroids without prescription. So these are the kind of reactions to this fear of this infection being seen in more and more cases. Tell us, how do you identify it early, and what is there to watch out for?
Well, now you have to divide them into two groups. One is that COVID positive patients who are admitted in the hospital, right? They are sick patients, and in the hospital, we have to be highly suspicious. They have to be labeled as high-risk patients, and these high-risk patients are patients who are having uncontrolled diabetes, patients who are having diabetic ketoacidosis, patients who are on high dosage of steroids to save their lives. They are high risk. They are a high risk group. And this is the group in which we have to be very careful for even the first and earliest sign, which may be as simple as just a small swelling in and around the eye or around the nose, or there may be a dark discharge from the nose. There may be an unexplained severe headache, which in a sick patient, admitted patient, may be overlooked. But now, since we know that disease is spreading in such a alarming way, we have to be very careful. And that is why already guidelines in Gangaram, and I'm sure in all hospitals which are treating COVID, have been issued that a special precautions have to be taken about the judicious use of steroids, about early detection of first signs of mucor, investigation, examination by a qualified ENT specialist and an eye specialist to see the most initial signs and symptoms. This is in COVID cases which are in the hospital. Now there are patients who have been discharged. They are post-COVID cases and they are at home. Now these are the patients who are actually panicking with all this increased incidence. These are the ones who are coming to us in hordes with, I have sneezed twice, I have had a small nasal discharge. And that is a panic reaction. But definitely a blood sugar checking, regular checkup, even after getting discharged and becoming all right from COVID, is a must to see that your sugar is not going haywire, it's not fluctuating. Secondly, any unexplained symptom like a severe headache, like a nasal discharge, like a swelling in and around the cheek, eyes, loosening of teeth, any black spots inside the throat, in the palate, these are absolute warning signs. And you must rush to a proper physician, ENT specialist, ophthalmologist, as the case may be.
Right, it's very important to catch it early. The costs are also very high of treating this infection. Dr. Mrig, also, why is it happening here in India more? Do you hear about cases like this in other countries as well?
See, India is a country where we have very dry and dusty conditions. Now, these mucormycosis spore they are present in the air and they generally tend to spread in dry and dusty weather. Also, there is a propensity of this disease to spread in the coastal areas because we have a tropical climate. Now, because of this COVID second wave, the immunity of the patients have suddenly dropped down. Many of them have taken a lot of steroids. Many of them have very high level of sugars, and this is the reason why the immunity of the patient goes down. And this is the time when these spores, they enter our body through our nose and they may enter through the respiratory tract. Now, otherwise, a fit person with a good immunity is able to fight with this disease. But if your immunity is compromised, then this disease spreads very fast. Like Dr. Swaroop said, these patients may develop with some signs and symptoms. And the best is to identify these patients very early and call them for a nasal endoscopy.
All right. Well, that is, what we know about mucormycosis and the steps that you need to take. And as the doctors are saying, you have to catch it early. That is the main thing that, you have to watch the patients, especially if they're home isolation, to catch any sort of infection early. We'll slip into a short break. We'll be back and the doctors will answer any questions, any doubts that you may have regarding this issue. So do call in on this number on your screens. Time for a short break. Stay with us. Welcome back. It's time now for our viewer question segment, and we have with us Dr. Ajay Swaroop, ENT departments at Gangaram Hospital. One of the questions that a viewer wrote into us, Dr. Sangam Ghosh wrote, what precautions to take to minimize the risk of getting infected with mucormycosis and alternative medicines of liposomal amphotericin B injection? I don't really like to talk about medicines on the show, but he had a question about alternatives.
Oh, well, it all depends on how, firstly, to prevent. Now, the major thing is you have to keep your blood sugar absolutely under control. For that, your treating physician has to be very careful. You have to be careful. Blood sugar is one thing which has to be meticulously controlled. And if your blood sugar is being well controlled, if you are off steroid, and if you are reasonably healthy, you are having a healthy diet, then there is no need to panic. That is what I want to convey, that there is no need. It is a bad disease. It has spread a lot, but we know the causes. We know the type of people who are going to be affected. Everybody, a 20-year-old healthy person who has recovered from COVID, has never had a history of diabetes. His blood sugar is absolutely all right. He's eating, he's resting. He doesn't have to bother if he gets one sneeze or a little bit of cold.
After and just a small point, doctor, this is not an infectious, disease or something, is it?
No. It is not going to be transmitted.
Just because people have that sort of fear about it, so I just wanted to clarify that.
No, absolutely not. It is not going to be transmitted like COVID. It is not going to be transmitted like COVID. It is a specific set of people, unfortunately, who are going to get this. So careful, yes, one has to be careful because COVID is a new disease. So we don't know what actually the COVID virus is causing that the incidence has increased. That is one point which I am sure the scientists are going to examine, study in detail, that does the COVID virus itself has something which is producing this. That is a point.
That would be interesting to know. We have a caller, doctor, from Pune, Keshav. Go ahead with your question, Keshav. Right, Keshav, do go ahead with your question. All right, we will try and reconnect with him. We have another question that was written into us by Shrikant Patil asking, who are the people more prone to this disease? Any precautions that one needs to take post-COVID treatment to avoid it? I think you kind of covered that, but just very quickly, doctor.
Yeah, patients who are inherently diabetic, initially diabetic, who had steroids, who had a stormy period, whose immunity is down, they are the ones who have to be extra careful. And by being extra careful, what I mean is a meticulous control of diabetes. Please, I'm again and again repeating, a meticulous control of diabetes, which will be monitored by your physician. You can do the finger prick test, and your physician will suitably alter the medicine. If your diabetes is under control, then your chances of getting mucormycosis become very, very low.
All right, doctor, we have Keshav back on the line with us. Go ahead with your question, Keshav.
Yeah, hi sir. How are you doing?
Right, go ahead.
Yeah, so actually my question is the mucormycosis will be affected for normal persons like without COVID infections and all? It can be deadly or something like that?
Doctor?
Yes, as I have already said at the start of the program, this is a disease which is already known, but it is a disease which only affects severely immunocompromised patients. Any patient who is healthy, even though he may be a diabetic, you see, India is now becoming a diabetic country.
That's right.
So even you may be a diabetic, you've not had COVID, there is absolutely minimal chance of your catching mucormycosis. But if unfortunately somebody is a transplant patient who's on long-term steroids, who's on long-term immunosuppressives, he is a diabetic, they are the ones who can have mucormycosis and used to have mucormycosis, but the incidence was so small and negligible that it was
Doctor, we have another caller from Goa. Amit, go ahead with your question.
Hi, good afternoon.
Yes.
Good afternoon.
Hello.
Go ahead.
Hi, good afternoon. I was told by some Ayurvedic doctors that by using gomutra as well as cow dung, by applying cow dung in the body, it can remove the black fungus. Is it true?
I don't know if you even want to answer that, doctor. Go ahead.
Well, You see, the point is that I am a scientific person, so I don't want to outrightly reject anything. But as far as I am concerned, it has absolutely no role, or as far as I can think, I can't sort of say yes to this.
All right, well, we'll end it there. Thank you so much, Dr. Swaroop, for speaking to us and sparing your time in these very difficult times. I know for all of you doctors, thank you so much for answering all those questions.
Thank you. Thank you very much. A pleasure.